Have you heard of the story of Eric?
You mean chemical Eric?
Yeah, the boy with the hormonal problems.
I heard he was 10 feet tall and 90 pounds.
Those are just rumors.
Good thing you're a med student, so we can find the case on file.
True, true. Apparently, his symptoms started appearing when he was 11. He had bad coordination and low stamina when he was playing in his Little League games.
And he had trouble with girls.
Dr. Carter, I still have trouble with girls.
When he was 15, he started growing abnormally. His height doubled, his hands and feet became monstrous. He had knee swelling in his right knee, and taps of his right knee removed up to 500 cc's of fluid.
Wow. The problem is obviously hormonal. What hormonal problem is it?
Well, apparently his pituitary gland isn't working because it had a tumor on it, causing problems like bad coordination, being very tall and skinny. But wouldn't there be joint damage due to rapid growth?
Yeah, joint damage would be associated because when you have a growth spurt, you get growing pains. His bones and ligaments were stretching quicker than a normal person's would stretch, and his joints can't keep up with it, which causes joint pain.
Well, it looks like he came back when he was 25.
Mm-hmm.
Oh, he showed symptoms of low facial hair and low testosterone.
Wow, that means the high possibility of being sterile.
Is there anything they can do so he can stimulate his spermatogenesis?
Yes, there is. They can give Eric hormones like FSH and LH to try to help stimulate it, but the lack of facial hair tells doctors that Eric's not producing any gluttonizing hormones. So Eric came back to the hospital when he was 28. At this point in time, he had a full-grown beard. And that's probably because for 2 years he started receiving HCG to produce sperm, but it did not work. He was still growing. At this point, he wore size 18 shoes, which is ridiculous. He now suffers from jaw pains and he was forced to get surgery. Why do you think Eric was growing facial hair?
Well, before treatments, Eric lacked a follicle-stimulating hormone. Because he's been injected with a new hormone, a gonad-stimulating polypeptide hormone, it stimulates his testosterone production in the Leydig cells and spermatogenesis. The stimulation causes, like FHH and LH, development of the secondary sex characteristics, e.g., facial hair.
Wow, you're probably right. I know Eric suffered from jaw pain, but why did he need jaw surgery?
Well, Eric is 28 now, right? So his bones are well past the latch stage of development. The hormones released by his overactive pituitary gland at 25 may have led him to have acromegaly. This is often mistaken with TMJ. The hormones may have caused a widening in the spaces between teeth or enlargement in the jaw. This may have caused him a lot of pressure to be placed on the joint. The jaw surgery expanded his upper jaw, allowing for more development and less pressure on the joint.
Oh, wow. Eric is now 45 years old and he is a medical phenomenon. His right eye stopped working and he had to get surgery to fix it. His right eye probably stopped working because he had a stroke 2 years prior in a jungle in Costa Rica. He also went to China and came back with tuberculosis. He also went to the Marshall Islands and suffered from beaver fever. And on top of all of that, he had trouble sleeping at night, and that was due to his pee schedule.
Pee problems?
Yeah, pee problems. Apparently he suffered from diabetes insipidus, and that caused his pee problems. Why do you think his kidneys were so active at night?
Well, you remember his pituitary gland is removed. That means there are disruptions in the normal production, storage, and release of vasopressin. The kidneys remove too much fluid from the body, leading to an increase in urination.
That makes complete sense. I forgot to mention, he had another issue. It also turns out that he has unpredictable shock responses, so that a small cut needing 3 stitches left him pale and in shock, while breaking his left wrist in at least 15 places did not. What hormone do you think is involved?
Well, again, due to his missing gland, the production and release of ACTH is stunted, leading to the unpredictable shock responses.
Oh, I see. Eric has many issues, but if the pituitary is so important and Eric is not getting replacements of hormones the pituitary makes, how is he still alive?
There are 4 hormones absolutely necessary in life: insulin, PTH, cortisol, and aldosterone. None of these hormones are produced by the pituitary gland, fortunately. Without a properly functioning pituitary gland, there are many potential health risks, as we see in Eric, but its absence will not result in death.
Oh, I understand. Well, Eric is just a medical phenomenon. I don't know how he's made it this far, and he is a very lucky man. Would you agree, Dr. Carter?
Yes, he lived up to the myth.
He sure did.